Hi, everyone. Welcome to Here for the Health of It podcast. We have a great show for you today. We have Dr. Morgan Herrington. She is an orthodontic at Midlands Orthodontics on Two Notch Road in Columbia. We discuss all kinds of things from her own experiences in the dental world to what she does, and a ton of conversation about her husband, who's a fighter pilot. So I hope you guys enjoy the show. Thanks for listening. Okay, hi everyone. Welcome to Here for the Health of It. We are Columbia's hottest podcast. I'm Dr. Randy. This is Dr. Tom. As always, thanks everybody that's going to our website. Here for the Health. Is it eight? What's our website? Actually, I don't know.
CFC for Health.
No, our podcast website.
It's just Here for the Health.
Here for the Health of It. Yeah. Or you can find us on Instagram. Here for the Health of It. We're on YouTube all the time. If you want to see clips there, we have shorts. And we have a great show for you today. We have Dr. Morgan Herrington, who's an orthodontist, and your office is in Columbia, right off Two Notch Road, Midlands Orthodontics.
Correct.
So thanks for being on the show.
Yeah, thanks so much for having me. I'm flattered and honored.
Yeah, this is great. We haven't had an orthodontist on our show yet, so this is our first time. So tell us, what do you do on a daily basis?
So I am a board certified orthodontist, and so anywhere from new patient exams, bonding braces, delivering Invisalign cases, debonding braces, retainers, all the things.
Nice. Fun.
Yeah.
So do you just love looking in people's mouths?
I do.
Do you?
Yeah.
Yeah. So when somebody walks in, what's the first thing you notice? How they hold their teeth, what their smile's like? Are they shy about it?
Jaw muscles.
I'm looking at everything when I'm talking to them. Before the new patient exam, we have someone who takes records. So intraoral, extraoral pictures, panoramic x-ray, cephalometric x-ray. So I can evaluate the profile. I can evaluate symmetry, asymmetry, and facial balance. And then, microaesthetics. I look in the mouth, the teeth, tooth morphology, the bite, the relationship of the upper teeth to the lower teeth. So all of it.
So you know a ton about the patient before they even see you for the first time.
Exactly.
You've already seen all their x-rays, their case, their photos, everything.
Yes. And I have my treatment coordinator kind of come to me and fill me in on who they are, why they're here, what they want. And so that when I go in the office, I can, help the patient decide what's best for them.
Cool. And you've been doing, when did you start doing this, or when did you know that you wanted to do it?
Oh gosh, I've known since I was in middle school. So when
Really?
I had my palatal expander, I was like, I want to do this.
Can you explain a paddle expander?
Yeah. So
What'd you say? A paddle one?
Was it a paddle expander?
No, palate.
Oh, you palate expander.
Palatal.
Oh, palatal.
Yeah.
I bet you said a paddle expander. I don't know what that means. Okay, palatal expander. So your palate was too small.
Yes. Exactly. Okay. So it's kind of a common treatment for what we call phase 1 orthodontics. So there's phase 1 and phase 2. Sometimes people need phase 1 or interceptive orthodontics. Mm-hmm. And one of those indications is a narrow upper jaw. And so a palatal expander is an appliance that we cement to the first molars or the second primary molars to get skeletal expansion, before the patient eventually hits puberty and that mid-palatal suture fuses in the roof of the mouth.
Oh, so I could have a bigger jaw if my parents decided I needed it.
Yes, you could.
Like how big?
But your parents wouldn't make that decision.
Well, if they wanted, let's say that I wanted a child with just like a big jaw because it was really in. Could you go?
It's really just the upper though. You're not doing it on the lower, are you?
You can't expand the lower arch. I mean, people try to use appliances, but you're only uprighting the teeth. That suture fuses before the age of 1, so that is not true skeletal expansion. Mm-hmm. But yeah, upper expansion is common and actually more common these days because people are wanting broader smiles that the teeth fill the entire smile.
Mm-hmm. Like Tom's got a big smile.
He does. Where'd you get your braces?
So I don't think I needed braces, but my parents still got them. I got them. This is back in Pennsylvania.
It was just like a clout thing.
Yeah, like I think it was just like everybody just gets braces because I only had to wear mine I think like 9 months, like something stupid where I was like, what are we doing here?
Maybe your orthodontist was really good.
Right. I mean, they were like, that's why I think my teeth were pretty big and good to begin with. And then they just said, let's just make them dino. And I won best smile, obviously, for my high school. No big deal.
That's awesome.
So,
No.
so is there something? So like, if you look at Tom's smile, is there something
What would you
that you
change?
would do?
Oh, yeah.
Smile for me.
I mean, they need to be whiter. Let's start there. But
Yeah, I mean, there's a little bit of wear on the incisal edges.
holy shit, you can see that from here?
I can.
Yeah.
Does that mean I'm
I felt
grinding?
it.
Possibly.
Okay.
You probably know if you're grinding more than I do.
Got
Let me
food
see
in
from
there?
the side. Turn to the side. Smile. Let me
With
see
your
your
mouth.
teeth.
Smile. Person smiles
This
with his
feels
mouth
weird.
closed.
I don't smile like this. I don't do that. This is more my smile.
Yeah, we like a natural smile.
Okay.
Now bite down, because that's what I really care about. No, you have a great smile. Yeah, class 1, canines. So there's different classifications.
If I wanted to improve them, what would I do?
Well, class 1 is what we aim for. So
Oh,
you're
really?
at ideal.
So I'm peak
Yeah.
state.
You're telling me
Peak
there's nothing
performance.
he could do to just improve.
Whiten them, which I agree with. But
Well-
that's always a pain. I just drink black coffee and
And
I
it's
do
so
too.
toxic. It's so toxic, the stuff they put on it.
the whitening.
Or is there non-toxic whitening?
No, not really. I mean, I don't really do whitening. You can get like crest white strips at the store, and I think they work
Mhm.
just as well. There's a lot of marketing in dentistry in general.
Right.
You know, you see like the bright blue lights that they're using for
Mhm.
whitening, and in dental school at least we learned that it depends on the exposure time and the concentration of the solution that you're using.
Right.
Light does enhance it, but that's
Barely. Yeah,
That's
that's what Shivani
marketing.
was saying.
Yeah. Today's episode is brought to you by our sponsor, Columbia Family Chiropractic, with 3 easy-to-get-to locations, one in Forest Acres, which is by Trader Joe's, one in O'Neill Court by the DMV, and one in the Northeast by Sand Hills. You'll be sure to have somewhere near you. They offer a ton of services from corrective care, on-site digital x-rays, spinal decompression for bulging or herniated discs, dry needling for injuries, pediatric care, and a Class 4 laser. They accept all your major insurances. And if you mention this ad, you'll get a discount on your first appointment. Check out their website at cfc4health.com or Google Columbia Family Chiropractic. That's cfc4health.com. When I was growing up, it was always just like old kind of dorky dentists, men, always
Oh
men.
God, mine was real dorky.
Yeah, and it was just like a thing. And now it's like Columbia has all these really attractive dentists.
Guys,
So-
he's talking about
Guys.
guys.
Just guys.
Well, the guys are still exactly the same as they've been, but there's like women that you're like,
that are in that.
yeah. And there was always this thing where I was like, I kind of the dorky 50-year-old guy who is kind of skinny, and I just know he spends all his time like in a lab or in front of a
Studying.
computer studying.
yeah.
I always kind of felt like, all right, it makes sense. But now I feel like there's just this new generational change where it's like you don't have to just be sitting in a lab for 50 hours a week in order to be a great dentist or orthodontist or
In
any
the beginning,
professional.
you do.
That's
Yeah.
yeah.
When you're in dental school,
Yep.
for sure.
Is there a lot of math, like geometry, trigonometry?
Chemistry. I feel like
Not-
chemistry would be in there.
For sure, chemistry.
How about metalworking? Smelting.
Soldering.
Soldering? Really?
Yeah.
Really?
So in my
Nice.
residency program, we had to make all of our appliances.
Wow.
Yeah.
Wow.
So like the expanders, I would make that. Like I would fit the bands on the patient,
What?
and then I would take an impression, pour up the impression, and solder the appliance to the bands.
Was there anyone in your class that just made such a terrible one that you were like, I hope I never go to them?
So I had 2 co-residents, and there was one day where we all cemented an expander on the same day. We made beds
Onto a fake
on our
onto an
patients.
actual patient.
Yeah,
Okay.
yeah. And it happened to align where we all cemented our expanders on the same day, and we made bets like whose was going to fall apart
Yeah.
first.
Jeez.
And
I came in second.
You did?
So,
Okay.
Like at least I wasn't the first.
Nice.
But
Could-
one patient did like swallow the appliance.
Oh God.
Yeah.
just a big piece of metal.
Yeah.
What are
like,
they- and
had to
then
go to the
what?
emergency
Oh my
room.
goodness.
There's like an X-ray of the expander like lodged in.
Oh my goodness.
That's
patient's
dangerous.
throat.
I never even
Yeah.
thought about that.
Oh yeah. But we're better at making them now. We don't make them anymore because you send it to a
Send it
lab.
to a lab,
Yeah.
yeah.
So I guess walk us through that whole process. So somebody comes in, janky teeth, you're doing a mold, like you do a mold, then you turn it into like a ceramic version of their mouth. Is that how that is?
We don't really do molds anymore,
Really?
unless we need a retainer right away. Now we scan. So
Oh, like digital.
yeah,
Oh, molds were the
Sweet.
worst.
they were horrible.
Just,
yeah.
all right, you're 8 years old. Don't move. Hold this in your mouth.
And
Oh,
they
yeah.
never fit. The mold, the metal piece never fit. It always dug in like way in the back here. And you're
Right.
trying to hold down. It was painful.
It's brutal. And, people with gag reflexes, it's not ideal. So
Yeah,
now
Randy
we have
doesn't have that.
scanners.
He's pretty good. Yeah, you don't have that.
No,
issue.
I don't know if I have that or not. Just to be clear, I do not know.
He won't eat bananas. But moving on.
No, I eat bananas. I just cut them up.
He doesn't. Yeah, that's true. So, all right. So you scan it with, is it like the x-ray that goes around, or is it a photo, or what is it?
It's a scanner. So there's like a wand that's connected to a computer, and you use the wand and you scan all the teeth, and it
Wow.
populates on the screen, and you send that to a lab or Invisalign, whatever aligner company you're using, and that's what they use to build an appliance off of, or a retainer or treatment plan aligner cases.
Okay. And then from there, a lab builds out what you want. And then what is the do you know length of time, or is it always still an approximation of, and then how do you know the destination? Like, do we know we're getting everybody to class 1?
That's the goal. Yeah.
But are there certain people where you look at them and they're like, there's no
Oh,
shot.
no.
Like, there's no way they're going class 1. Does that happen?
You want to go class
Yeah.
3. What's
Really?
the worst
Well,
class?
Class 2 or class 3.
Oh, okay.
It just depends.
Yeah.
Like there's degrees of severity, right? And so some people, they have a skeletal discrepancy, so they might require jaw surgery to correct their bite.
Mm.
Oh,
Some
yeah,
people, it's just the teeth are positioned too far forward on top or bottom, and you can fix it with dental movement. But sometimes it's a combination of both. And so, it's really important, especially with board certified orthodontists, we're trained to look at all of those and make measurements so that we can make the best treatment plan that's going to have the best long-term results.
Are there any non-board certified orthodontists?
Yes.
There are.
Mm-hmm.
Can
What?
one can one go to them?
Yes.
Like in the US? Really?
Well, there's dentists who practice orthodontics, but they're not orthodontists.
No kidding.
Mm-hmm.
Because I always wondered that. Like, you always hear the board certified surgeon, board certified
Yes.
orthodontist, but I was like, aren't they all? And they're not.
They're not.
Wow.
Yeah, in chiropractic, you're either just board certified or you're not. There's no.
Maybe we should start.
Non-board
We should start
certified.
saying it though.
I think there was a rule about. I think we're not allowed to say it because
Board
it's not even.
certified.
It's not even a thing for us.
So you have to be board certified to practice.
Yeah.
That's how it should be, I feel.
Right, but we don't.
Interesting little
There would be like
loophole
the
here.
dentist. You have to be board certified to be a dentist, right?
Yes, they don't necessarily call it that. You can call it licensed.
Licensed. Okay.
Gotcha.
And
so
then,
that's probably it.
yeah,
Like, if you
so-
wanted to be a specialist in the chiropractic world,
yeah.
you'd
then
say
you'd be
board certified pediatrics or something.
I guess if we have who's the board?
It's a group of individuals.
50-year-old
that-
men that are dorks.
Literally.
That's what I pictured.
Yeah.
That essentially oversee the examination process and come to conclusions on, treatments and kind of board articles that we follow in order to base our treatment plans on. So big
I see.
emphasis on research.
So then when you do that assessment and you kind of categorize them, then you would say you want to get them to class 1 ideally. What's the time frame? Like, what's short end versus long end?
So phase 1 treatment that we were talking about earlier, normally I like to get those done in 12 months or less. Sometimes they can take 14,
Oh, nice.
16 months if we're doing a little bit more. But adults and teens can vary.
Okay. Is that faster than, like, I feel like it was always like 2 to 3 years when we were kids.
Well, maybe some orthodontists combined them. So there are some that will
Gotcha.
start the braces earlier, and then the patient is in braces longer. That's not necessarily how I like to do it. If they need a phase one, I'll do interceptive orthodontics while they're younger, anywhere from 7 years old to maybe 11 or 12, and then wait until all of our permanent teeth are in to do phase two.
Gotcha.
So the rubber bands that we're always on, is that still a thing?
Yes.
And then the metal pieces that you could always get them a different color. Is that still a thing?
Like the O ties that
Yeah.
hold the wire in
Yes.
place. Yes, absolutely.
So what color do people normally go with?
Whatever they want, but usually they correlate it with the holidays or like the seasons, which is fun.
And change it out every few months?
Yeah.
Oh, I didn't know that you could change them.
Yeah, so we see them typically every 6 to 8 weeks. But rubber bands are definitely still a thing.
They are?
And I still know when you're lying. When the patient tells me, oh, I wear them all the time, I know.
Really?
Yeah.
Well, can you
because
explain
they're
it?
not class one.
Yeah. Good
You
point.
know?
What? So the rubber band does what? You have to put the rubber band. I don't think I ever had rubber bands in my teeth.
So you wear rubber bands typically from top teeth to bottom teeth, and it helps improve the bite relationship.
Oh,
So coordinates top teeth and bottom teeth.
got it.
Those are gross, and those were the gross ones. Not everybody needs those, right? Like I feel like if you had the big rubber bands, it was gross.
Yeah, there's
You
just
were
always food.
You were
and
just
spit on them.
gross orthodont braces person. Because I don't think, I feel like what he's thinking about are the ones that were right on the front of the teeth.
Yeah.
Like you could change the colors of those.
Yeah.
Well, that's that's separate.
Yeah.
But then there's rubber bands too
In the back. Oh,
that
yeah,
are
you
go
don't
top to bottom teeth.
You don't want that.
Some people, they'll get like clear O ties, like the ones
Yeah.
that hold the wire in place. And I warn them, I'm like, look, if you have mustard, curry,
Oh, God.
anything, like you're done.
Yeah.
Like you're coming back to me.
'Cause
And
it
I don't
looks
want you to
just-
do that.
Oh God, yeah. So you'd almost let's talk about all the styles that are out there. What are the options if somebody wants to straighten their teeth? I've seen mouthpieces. So you're saying the metal's still a thing. I've seen the clear, what are they, Invisalign? But you still see them and they look gross.
So kind of two different
I
types
got a
of
lot.
I
I got a lot.
You don't see them in photos though. That's the nice thing.
That's true. They've definitely moved things in a more aesthetic direction.
Mhm.
So two types of braces, basically, the metal braces, and then we have clear braces too.
Okay.
And there's a lot of different companies out there. Light Force is one of them that we provide. And then you have clear aligners. So
Mhm.
those are kind of the two major categories.
Yeah. So a patient walks into your office. When should a person come to see you?
What age?
So as early as 7.
Okay.
So yeah, that's I typically try not to start them that early because there's sometimes some maturity issues, and
Right.
there's some that are champs though. Like they'll let you do whatever, and so good in the chair. And then there's others that I wish I had waited a year or two to let them mature. But as early as 7, but just knowing that we don't always start them right at 7 unless there's an issue
Yeah.
that we need to correct at that time. And then, as old as whatever. I mean,
90.
Yeah. What's your oldest?
if they still
you've
have
worked
teeth,
on?
yeah. I
Yeah.
mean, we can straighten them as long as the bone and tissue health is.
Do you recall the
appropriate.
oldest person you were like, wow, I can't believe they're
Probably like 70s.
really?
Yeah, 70s.
That does seem old because
Yeah.
you'd probably just go dentures at that point. Wouldn't you?
Dentures.
I would.
Start using dentures with your patients.
You should just say,
You
let's
better take care of your teeth. You're gonna put some dentures.
let's
in.
get some dentures. You don't need these braces. Yeah, I guess with that though, have you seen when they do the palate expander early enough, sometimes they don't need braces?
No.
Is that a thing?
No, because there is still some coordination that needs to occur between the top and bottom teeth.
Mm.
And sometimes when you do that palatal expander, you do get a little bit of expansion on the bottom, like those teeth will upright with the bite. But typically, you still need
Something.
a second set of braces because you can't predict if the permanent teeth are going to erupt in a perfect position. And usually they don't.
So would there be a downside to waiting until they're 16 or 17 and then doing it all at once?
Yes, because if they needed expansion or if we wanted to do a little bit of that class 2 or class 3 correction before that, then it's too late because by that time the mid-palatal suture has closed and growth is kind of on the downward slope.
What was the age that it closes again?
So it kind of depends, male,
Okay.
female, but usually around puberty.
Okay.
I don't typically do an expander past the age of 14, 15.
Gotcha. And there's a way with X-ray you can tell that it hasn't fused.
There are ways. We don't necessarily take that. I just kind of ask them preliminary questions in our
Okay.
exam.
Randy hit puberty at like 7, so
I
he
hit
might
puberty
have-
so early.
he
I bet
might
you my
not
jaw
have.
fused. Well, and you know what? I had a whole bunch of work done when I was probably 8 or 9, and then it all went back wrong.
Yeah.
And then I had to get things all done again. It was just like a nightmare. And I don't know what happened in that, but now that I'm hearing that, maybe I was just fused too early.
Maybe. Do you have a crown on?
Oh, he's got all kinds of shit.
I
in
got
there. It is wild
Yeah,
what's
I
happening.
So I'm from Canada and I played hockey a lot.
Okay.
So
Nice.
most of my teeth have been broken, knocked out, the whole thing. So they're all just fake.
Okay. Interesting. I see y'all play golf.
Yes.
Do y'all both?
Yeah. See that
Oh,
trophy
yeah.
over there? Ella, grab that trophy real quick. I just won that this weekend. No big deal. And it's-
Congrats.
Oh yeah,
Yeah, there it is.
sure.
I didn't know if we were going to use it. I thought you'd bring it up, and I thought maybe I just might as
Actually,
well bring that.
can you bring the photo over there too? for us?
What's,
Our-
now, Morgan, here's what's great. These are fake. These are our friends get together and we just play and we make trophies. Like they're not real events. And then we have a golfer of the year thing that's going on right now. Randy's actually in first.
Yeah, I'm
It's
winning.
quarter one.
Mhm.
Quarter one. It's
2
early.
big tournament wins.
It's early.
You know who Scotty Scheffler is?
I do.
I'm kind of like him right now, but in Colombia.
I was about to bring him up.
But it's all made up. Like it's ridiculous. So we just make this up and we come up with things. And I'm the MMM champion, and we don't even know what MMM means yet.
That's
But our-
impressive.
yeah, no big deal.
Congratulations.
We did this ad at Oak Hills Golf Course, and I'm holding a 3rd place plaque that I won
And then I think
from
a
my
bunch of-
friend Perry Parks. He put on a big tournament in his backyard, and I got 3rd
Yeah.
place.
And then there's like track and field medals I think we're wearing, right?
Hey, a win's
Yeah.
a win.
Yeah.
Yep.
Do y'all know who Jordan Spieth is?
Yes.
I played in a golf tournament
No.
with him.
What?
Yeah. So I'm from
That's cool.
Dallas originally.
Okay.
Oh yeah, we should have probably talked. We should talk about her more.
Yeah.
So you're from.
I thought this
you're not-
was going great.
I like talking about
Things
y'all
took
too.
a turn for the
It's
better here, and
fine.
then we were like, okay. So wait, you're not from here. You grew up in Dallas, and then
Mhm.
you stayed in Dallas for how long?
Through high school.
High school, and then what happened from there?
Went to the University of Alabama for
What was it?
undergrad.
Nice. What was that like?
It was awesome.
You were on a scholarship for sure. Academic
I
scholarship.
had a little bit of a scholarship, but we won 2 national championships
While you were there?
I was there. Nick
Wow.
Saban era. It was awesome.
That is awesome. How were the
That's it.
parties?
It was fun.
they- Did you meet your husband there?
No,
You did not.
no.
Where did you end up meeting your husband?
At a bar.
In Alabama?
Actually, yes.
Really?
Yeah.
Was it a nice lounge, or was it like a honky tonk?
Yeah.
It was kind of a honky tonk.
Yeah.
Nice. What was he wearing?
A Hawaiian shirt.
Like
Or
a button down?
Yes.
Like a
It was
t-shirt.
Cinco de Mayo. So it had like margaritas on it, maybe
Yeah.
like a Jimmy
Mexican
Buffett.
flair, yeah.
Mexican flair.
Sweet.
And did he have some good moves? Let's
Did
go
he-
down this road a little.
Kind of. We got there late, me and some girlfriends, and it was called Moe's Barbecue. It's just a, barbecue joint, and they had a
Mhm.
live band, and I guess the guys had been there for a while, so they had a table, and so we were like, let's talk to these guys. We want a seat.
Oh, so you kind of initiated it.
Oh.
kind of.
So he was with a group of guys, all military guys?
Yes.
Nice.
hmm Yeah. So I saw him at the bar and kind of scooted over there. I saw him with a $20 bill. And I was like,
Just nice at that time, right?
yeah. I
Yep.
was like, I would like a drink.
And do you remember when he realized that you were really smart? Was there a moment when he was like, "Whoa, she is smart"?
I do, because he thought I was a dental assistant, which is not a big deal. But I was like, no, like I'm going all the way. Like
Mhm.
I'm in dental
Yeah.
school at the
Mhm.
time, and at that point he was like, oh, okay, all right, she's smart. Like
Was he? But he wasn't intimidated.
No,
He's a fighter pilot.
he really doesn't get
Doesn't care.
intimidated or nervous, which is kind of frustrating because
Wow.
I do. I get
Yeah.
anxious about things, and
Yeah.
he's just cool as a cucumber. Like nothing really bothers him.
How were his teeth at that time? Were they good?
Yeah.
You were into that?
I'm actually doing his Invisalign right now.
I was going
Really?
to ask, is there anything you would change about his teeth right now? So
yes,
you're working on that.
we're working on it.
Good.
He doesn't always follow my recommendations, but I'm doing what I can.
Not always
You
the
know?
greatest. Husbands don't make the greatest patients all the time.
Right.
No, they think they know best, right?
Yeah.
What about a mustache? Like, you
Does
see
he have a
Tom
mustache?
Tom has a mustache
Just
there.
realized I
I'm
have a
just
mustache.
I'm just wondering if that is a good look for teeth or bad look for teeth.
I think it kind of highlights. It's like a little top hat for your teeth.
I don't see a lot of mustaches, I'll be honest, but my husband will
Put one on
do the
every so
mustache
often.
every once in
God,
a
it was a
while.
pilot.
It's a fighter pilot thing.
Yeah.
Yeah.
Does he have sweet sunglasses?
Yes.
Great vision. Have to.
Yes.
Yeah, that you have to have 20/20 vision, no glasses, I think.
Yeah.
How old is he?
32.
Does he golf?
It's good.
He does.
Nice.
But he didn't like grow up golfing. He's just like very athletic. And
Yeah.
so kind of anything that he picks up, he's automatically good at, which is
Also
difficult
frustrating for you.
because I'm very competitive and I grew up playing
Mm.
sports too. And so that's always a fun argument.
He's got to be good at pull-ups. Like, how many pull-ups is that guy ripping off?
Push-ups.
I don't know.
Push-ups,
He
pull-ups.
played football in college. So
No way.
he was the kicker for the Air Force Academy.
Dang.
And
That's
I
great.
feel like fighter pilots are always gamers too.
He's
Video
actually
games?
not,
A gamer? Yeah, video games.
which I'm thankful for
Yeah.
Yeah.
You don't want to
because
game.
I would be naggy about that.
It's a
You wouldn't
lot.
appreciate that.
No.
It's a big thing now. How about in your circle of friends? Do you have any friends that have bad teeth that you just like look at and you're like, why don't you come see me? What are you doing?
And if you could just say their first and last
Or do
name
you-
and call that on the
Yeah.
podcast, that'd be
Yeah,
great.
you could do that. Or have you probably weeded them out? You just don't even hang out with people with bad
Mm.
teeth.
That's not true. But my closest friends, I would say, all had orthodontics growing up.
Yeah.
But some of the fighter pilots, I would love to.
Do something with.
Yes. I wish they cared more.
Yeah.
I feel like guys so guys I feel like can get away with it a little bit more, right? Or no?
What, crooked teeth?
Yeah, like it's like and maybe that's just me growing up playing hockey where
And thinking he was getting away with it.
I just like my buddies would all be missing teeth and it was just or broken teeth and it was just like a normal thing for us.
I don't think
Not
that's
these
true.
days, yeah.
No.
I don't know where you're getting
Not
your
allowed.
data.
No, it's in Canada.
Yeah.
Here, if you're missing teeth, you're usually on drugs. In Canada, if
Right.
you're missing teeth, you're just a hockey player.
Yeah.
Right. No, I think straight teeth for males and
Across the
females.
board.
Yeah. And you're more likely to get a job. I saw that stat come out
Really?
recently.
Yeah.
Like 45% more likely to get a job.
Wow, that's a lot.
Yeah.
Are there orthodontists in England? Because I feel like that's the place, that's the market that just needs it. And I just don't know if it's like a thing over there. It's like kind of like Canada where they
It's funny because I try to keep up with the literature, and there's this orthodontist that blogs out of
Yeah.
the UK, and he sends these articles like
Just-
once a week, and I
Yes.
like to review them, so I'm up on the literature, and it's hilarious to me because I'm looking at his teeth and
They're
the
just so
teeth over
bad.
there, and I'm like, what's going on?
Now, does this happen too? Like, and I don't know if this is an inbred thing since you were in Alabama, but like where teeth are literally growing from the palate, like way back in here, or like doubling up. Have you seen any of that? And like, there's no way you're moving them, right?
Sometimes.
Really?
Yeah, so you would call that like an impacted tooth if it's still under the gums and the
And do they come
bone.
from the same root? Is that, or they're separate and they kind of come and just bend in?
separate tooth buds.
Okay.
But
That's what they're called.
if
Buddies.
they're starting dentees,
Mhm.
buddies, if we're in like the younger population and they start coming in right behind one another, some people call that like the shark teeth that
Yeah,
are starting to happen.
yes.
But if you don't do that early, like interceptive orthodontics,
Right.
and you see those canines, the permanent ones, and the X-ray, and they're starting to cross over the root of the lateral incisors,
Yeah.
there are things you can do to intervene to try to correct the position. And if you don't, then you might get an impacted tooth. And at that point, you would wait for full braces or top braces, and you would send them to an oral surgeon to remove some tissue and bone so they can put a little bracket on the tooth, and you basically reel it in like a fish.
fishing.
Yeah.
No way.
Yeah.
That's crazy. I had a friend growing up who was, I mean, it was bad.
Yeah.
And I think it ended up getting fixed, but I mean, it was kind of too late. You there's that time where like you need to get it done before you get into high school.
Right.
Because at that point you're just toast.
Yeah. And it's more difficult with
Do you agree with
adults
that?
too.
Right? I mean, people are getting made fun of a lot. Teeth are like, that's your thing. Like
Yeah.
you could
a
have
big
good
deal.
teeth and probably smell bad and be like scrawny. And if you have good teeth, you're okay.
I don't know about that.
It's a big thing.
Maybe I should start telling my patients that.
Tell them that.
Yeah.
Play
Yeah.
this little clip in your hot seats for them. Get your kids in early.
So, have you seen The Matrix with Morpheus? He has like the big gap in front of his teeth,
Yes, but
and it's like a trademark. Let me show you. So that's his look. He just has a big gap in the front of his teeth. Do you have anybody that is come in and they're maybe like a celebrity and they want to keep an imperfection in their teeth because it's their trademark?
yes.
What kind of things?
Well, a diastema. So that's one
Okay.
thing. That's what that space is called. And I've
And they just say fix
definitely-
everything else but leave the space.
Well, sometimes I'll forget and then I'll close the space because that's what you're supposed to do.
Oh.
Like that's ideal. And then, by the end, they're like, are we going to get that
Open the
gap
space back?
And I'm like, oh, God.
So you've
My
actually
name is on
you've
this.
actually opened people's front teeth.
I actually haven't yet. I mean,
That's
the patient
wild.
luckily was like, I like it. Like it looks good.
Yeah.
But I'm trying to think of anything else that patients have asked that's weird. I think diastema, like keeping that has been probably.
Could you, if somebody did want to like stagger their teeth, is that a thing now in dentistry where they just don't want them all lined up, where they want them like almost like this, like one goes this way, one goes this way, and just keep going? Like, could you almost like create a design of teeth?
I guess you could, but at the end
Maybe
of the day, like my name is on that. And
Right.
if they're really wanting to do something that's
They'd have
like
to.
that, I might refer them elsewhere because
That could be the new thing in the teeth game,
maybe.
Right?
Probably not.
right?
Yeah, at the point
It's
where
not functional.
everybody
It's not
just
really-
has straight teeth, there's people that are going to want to start to have
The
crooked
vampire,
teeth.
vampire teeth are a thing now.
Mhm.
Yeah, I don't
You don't mess with
engage.
that.
Do any of
I
that.
don't mess with that.
No, you say wrong office.
Yeah.
Now is it weird that ortho means straight, Dontics means teeth,
Right.
but the teeth are actually on a curve? Do you find that strange?
I do. Yeah.
Why aren't we saying like curved teeth? And I don't know I should have looked that up, but I don't know what the Greek for curve is.
Well, I mean, you've broken down the word. That's what we've gone with. But you're correct. I
Yeah.
mean, ideally, we align the teeth on an arc or an arch form, and that's ideally the
I
best
thi-
shape.
See, that'd be a cool name for a practice. Whatever that
What?
word is. Arched Dontics. Like arch in Greek. Or curve. Or is there a perfect angle? Like, is there a number where you like measure the inside where you're like, oh, it's 62 degrees?
There is not a perfect angle to the shape of the arch form,
See, that would be sweet.
but there are like standards that we try to accomplish, by the end of treatment.
Yeah.
So
What's the range? Do you know the range? See, we know for the neck, it's supposed to be straight front to back, but it should be 45 degrees from the side. So 45 degrees is a big deal, which you're looking at two perfect 45-degree curves
So
here.
there are
No big deal.
parameters for like the angulation of the teeth.
Yeah.
So that's why we take the like profile X-ray, a cephalometric X-ray, so that we can see the
Run that.
angulation of the upper and lower incisors. But ideally by the end of treatment, you're trying to get the alignment, of course, in general, to be straight. You're trying to get the marginal ridges or the heights of the teeth to be ideal.
Oh, like up and down.
Correct.
Yeah.
And then overjet, or the distance from the top teeth to the bottom teeth. The teeth should be coupled by the end of treatment. So top teeth and bottom teeth should be touching there in the front. And then the occlusal relationship that we talked about, class 1 is what we aim for. The occlusal contact, or the way the top teeth and bottom teeth touch. And then you don't want any spaces by the end, and you want root parallelism, I guess.
It would be cool. Like that'd be a cool tattoo if you knew the angle and you just got that, or name of your office. Either way, but I'd probably like throw a lower back tattoo of like 42 to 62 degrees is my guess.
I'll keep that in mind if I ever
If you
open my
ever-
own practice.
If you're ever thinking about it.
Do people have a lot of lip tattoos and like tongue rings? I know were a big thing for a while. I see them, the rings inside, like the little frenulums.
Yeah, I definitely still see that. Tongue rings, not as often as I used to, but I've seen like tattoos on the inside of the lower lip, and
It would get caught. I feel like a tongue ring would get caught in the braces.
I guess it could, but I've seen it kind of strip away the gum tissue on the backside of the teeth, and that's not ideal.
What if somebody gets something stuck in their tooth, like a T-shirt or something? Do they go to you for that?
Like
so-
in their braces?
Yeah. Like I remember I playing basketball, and they have like the fishnet,
Yeah.
and I like wiped my mouth and I got it hooked on here.
Yeah.
And for a minute I freaked out because it like I couldn't get it off, and then I just yanked it, which
Broke the braces.
I think so.
Yeah.
But I was thinking, what do you do? Like I would have to literally just walk or like go to bed at night and like until I could get to. Is it you that I would go to, or would I go to the ER?
You would come to me unless there's like trauma.
Yeah.
Like busted lips, busted teeth, and they have braces. They should go to the ER or to their general dentist.
Is there anything strange that's gotten stuck in a tooth or in a brace?
I've seen like a kid that was like chewing on a blanket.
Yeah.
And so the blanket got caught
Like
up
yeah.
intertwined. And I've seen hair. I don't even ask questions. I'm like, okay, this.
What kind of hair?
I somehow knew it was going to go there. I don't know. I just hope that maybe they're chewing on their own hair.
Yeah. Now, you've never run into the case, and this might be myth, where two people kiss and they interlock braces?
Yeah.
Has that ever happened?
I've never seen it.
Okay.
Sure, it's happened.
And that's like
Could.
a possible thing?
I guess so.
I feel like growing up, I was made to believe that happens
Yeah.
all the time.
I feel like that's probably in movies.
Right.
It's a good storyline.
Now, I also saw, are they doing braces on the inside of the teeth now? Is that an
Yes.
option? So you don't see them on the outside?
I don't do
That's
it.
cool.
It's called lingual braces. Newer technology. It is very much a niche kind of treatment.
Gotcha.
There are some pros to cons to everything. And, some people, it rips up their tongue and it's uncomfortable. Over time, you do get used to it, or so I've heard, but it's not something that I'm like specialized in. And maybe I'll get into it one day, but at least putting the braces on, like you want a dry field as much as possible. And doing that behind the teeth is very difficult to do, especially on the bottom where the tongue sits.
I want to talk about jawzercisers.
What's that?
It's
So
a rubber ball. Basically.
yes, a way to strengthen your jaw. And the theory is that you have weak masseter and pterygoids. All the muscles in your jaw become weak
Okay.
because most of our food is cooked and soft. So as you get older, you kind of get this double chin and your jaw gets weak. So it's an exercise for your muscles where you put a ball in the front of your teeth or in the back, and you just bite down hard constantly and you work out your jaw.
Okay.
It seems like that could mess with your teeth.
I feel like it definitely could. What is the ball made of? Rubber?
Yeah, like a
yeah.
thick rubber. Think of like a thigh master, but in the shape of a ball.
Yeah, like
that
a
you
small
just-
tennis ball is kind of how I think it is.
Okay.
Or like a squash
And
ball.
you just go, you just chomp up and down on it.
Is there any evidence behind that?
Supposedly.
Well, I don't.
Well,
testimonials.
stories.
Yeah, photos.
That's what we trust. We
Yeah.
trust stories and
Reviews.
Yeah, reviews.
Well, because I feel like you're looking in people's mouths so much, there has to be a jaw strength difference from one person to another person,
There is.
right? Like you look at some people and you're like, oh man, they have a strong jaw.
Yeah.
They eat a lot of meat.
Yeah, there was a celebrity that just went and had jaw implants.
Zac Efron.
Zac Efron, yes.
Which is ridiculous.
Crazy.
But
I
he
mean,
looks
He's a-
chiseled.
But
with
he
them.
was a
I
good-looking
kinda
guy
like it.
before. Like,
Right.
I think he screwed himself up.
It's
He looked
genetic.
pull up a
like a
photo.
mask.
Like it's the shape of your lower jaw that kind of determines,
Yeah.
how strong the musculature is. So people with more of like a square jaw form, they
Yeah.
have those stronger muscles typically. And then the people with what we call like a higher angle or a steeper mandibular plane
Yep.
angle, they're the ones with kind of the weaker muscles.
Gotcha. All right.
All right, let me show you his
See if
photo.
you can find a before and after. He had a gap in his teeth. I think he got his gap. He had
Yeah,
a gap
that was a
fixed.
big thing for him too.
Randy grew his hair out to look like Zac Efron at one point. And we're not talking too long
See,
ago.
Look how chiseled his jaw is.
It looks stupid. That looks stupid.
It
Yeah,
does.
I think it looks silly.
I thought
too.
he looked great before.
Right.
It's not necessary.
Yeah, he's just so insecure.
I thought it was maybe like
True.
I
So
think
true.
it's true.
fillers, Botox, that kind of
Yeah,
thing.
a lot of
but
that
it
stuff.
was implants.
Supposedly he'll never admit to it, but that's what the experts are
Yeah.
saying.
Looks like it.
Are there any other cool technologies out there for like straightening teeth, like home stuff, or is that? And I think that is a thing now where you go somewhere and then they just do a scan of your teeth and then they just ship you stuff at home.
Well, Smile Direct Club went under.
Is that? Oh, it
so
did.
yeah. And I've seen some of those patients come to me.
Was it
and
rough? Like they
Yeah.
wasn't working.
Well, they're not looking at the whole picture. They're not able to determine, like we were talking about earlier, the skeletal discrepancies.
Mhm,
Because they're not taking the x-rays or diagnosing properly.
mhm.
When there's severe crowding, like those companies that you're just getting like aligners mailed to you, they're not able to do what we call like IPR or interproximal reduction, where they go in between the teeth and kind of shave them down in order to accommodate all that crowding. So yeah, I don't know how they were able to do it for as long as they have.
So that's done. There's no real at-home straighten your teeth.
I think
kits.
there are still some direct to
Something out there.
consumer companies out there. I would not do that. If you're going to spend the money, go to a professional,
Yeah.
go to a specialist, please.
board certified.
Board certified.
So can you speak to the cost a little bit? Because I know that's a worry of some people.
Is insurance covering it these days or still cash? Oh, insurance.
No,
helps?
insurance does.
Really?
That's nice.
And that's a whole other beast. But, you can be in network or out of network as provider, and based on your benefits, some might cover treatment. Some insurances are better than others, but, costs can range for everyone. And we don't like to quote, over the phone because, they could think that they just have a little bit of lower incisor
Right.
crowding and they need jaw surgery, So
Yeah.
like there's so many different possibilities.
Yep. So we'll start with an initial. If a person's like, I might need it or I might not, or I want to bring my daughters, who I'm like, I don't know what they need.
So pricing, is that what you're
Well,
talking
yeah,
about?
just or even like, what does the initial visit look like? Is it, do you get x-rays from the general dentist? Do you get separate x-rays when they come to see you? Is it just a wellness visit? What does it look like?
I try to do as much as I can in that first visit.
Okay.
I mean, we get all the information that we're able to from the general dentist or whoever referred them. And then, we take our records that we talked about earlier, photos, x-rays. I treatment plan the case in typically about 5 to 10 minutes. And then if I can't do it that quickly.
So you might know the first day what they need.
Oh, yeah.
Wow.
But sometimes, it's complex. I might need to consult with a surgeon or a periodontist or whoever might be involved with the treatment. And I typically go back to the room with the patient. I'll do an exam chair side, make some measurements, and then we'll come up with a treatment plan. But I typically try to do it all that day. And then after I leave the room, the treatment coordinator will quote fees.
Yeah. Nice.
Would you ever go to an orthodontist that doesn't have straight teeth?
I probably wouldn't.
Yeah. Because I'm thinking back to mine, and I think he did have a big gap.
Really.
I don't
A
think
lot of dentists, though, have
yeah.
issues. And I'm like,
What are you doing?
what are you doing?
That's
Like, you should be your own billboard.
right.
But that can kind of backfire sometimes because I've had patients that are like, I want your teeth. And I'm like flattered, like that's really kind. But that speaks to, my orthodontist and my genetics. And
Right.
I can't guarantee that.
Mhm.
Would you change anything about your teeth?
There are a few minor things.
What would you do?
Um,
Move number 7. I don't know what
the torque on upper right too isn't right. And I have a little bit more of a deeper bite, class 3 tendency. So I know y'all all are tracking that.
Yeah, I'm writing notes right now.
Yeah.
So do you have to wear a retainer every night still?
I still do.
You do?
No.
Yeah.
How long you been wearing it for?
Since I was 17.
No way.
Yeah, same ones.
So, all right, yeah, let's talk retainers.
Oh,
This
I
is
can't
good.
wait to get into this.
Well, because I feel like I did it for a little bit. Then I was like, what am I doing? And then I just stopped very quickly, like maybe within months of wearing it.
Yeah.
And the recommendation is for the rest of your life. Is that the official stance?
Nighttime for a lifetime.
Wow.
Oh, that's a good tagline.
Yeah.
That's a good t-shirt.
How often do you have to get it replaced?
It depends. Like some people have the permanent retainers, and typically those will last a long time if you treat it properly.
Mm-hmm.
That goes on the back side of the teeth. It's an orthodontic wire that's bonded to the teeth to keep them straight. And I typically only do those if we started with severe crowding or an open bite, or there's several indications to do them. But those should last a long time. And then, you can do the clear retainers, the holly retainers, and I have my patients wear them full time for 2 months after braces come off, and then nighttime for a lifetime.
Mm-hmm.
The recommendation from the literature, I believe, is 120 days for the tissue and the bone to stabilize, but no one's doing that. Like,
right.
You can ask someone, and maybe one person out of 100 might do that.
Do it, yeah.
I did that.
Are there certain foods that you should or shouldn't eat with braces?
Oh, yeah. The sticky, chewy, hard, crunchy, all the good stuff. You can't have it.
Mm-hmm.
And that's why a lot of people will do aligners. That's something they can take the aligner out, eat that stuff, and then put the aligner back in.
That's nice. So do you want to talk about when you're going through the thing about how do you should you take your retainer out to kiss your spouse?
Yeah.
Because that was a big thing.
What
They
do
were
you
they were literally here one day like talking about it.
Yeah.
And I was like, well, I'm wearing it all night. I'll just kiss you like this. And I was like, well, no, you should take it out and kind of hide it. But then it's kind of gross. So what do you do with it?
Just a romance killer. So yeah, at night you got your retainer in.
Yeah.
Your husband gets home late. He was working till 10:30.
Shirtless, sweaty, just looks great, smells great. But you're in bed and you got your retainer in. He comes in. What are you doing? What's your move? You're just plopping it next to the bed.
I'm definitely going to take it out. Yeah.
Yeah. So Shivani was saying like she just leaves it. They just like her and her husband just leave it in. I'm like, that's weird.
I mean, I guess if you both have it, maybe it's less weird.
Does he ever? Oh, he doesn't have it yet.
He has Invisalign right now.
Yeah.
But he did have this awful, huge mouth guard.
Yeah.
It was
Like
so
like
gross.
a what is it? Like a grinding guard or whatever those are?
Yeah. He grinds his teeth.
Yeah. So he's dealing with some stress. He's got some demons at night that he's dealing with.
I will say when he came back from deployment, it was the first time I had heard him grind his teeth, and it woke me up.
Yeah.
The noise of it. Yes.
Where was he deployed? Where did he have to go?
The Middle East.
Dang.
Yeah. He was there for 6 months during COVID. So he was supposed to get home in April of 2020, but COVID hit obviously in March, and they couldn't figure out how to get the guys home. And so he was there until the end of May.
Wow.
Yeah.
What was it like in the dental world during COVID?
Oh gosh. So I was in residency, and the PPE that we had to wear, I mean, over the top, the masks.
Hazmat suits.
Yes, the hazmat suits. I think back about that, and I was like, one day I'm going to have to explain this to future kids that I looked crazy.
Right.
I had triple masks on, and a gown and hairnet and, shoe coverings. It was crazy.
Your kids are going to think you were doing work in outer space.
Literally. Did
Cover-
anything change in y'all's world?
We didn't really.
Not too much.
We didn't do anything.
Like you didn't work?
No, we worked.
Okay.
We didn't stop, but we didn't do any of the PPE stuff.
That's
We
so
just
nice.
because we just knew it was all BS.
Yeah.
But we look at things always differently in the chiropractic world on anything that happens. Like again, a year before it was like the bird flu or Ebola or the Zika virus.
Right.
Like all those things were just another news scare everybody, but then coronavirus just hit and everybody bought into that one. But then the other stuff just went away.
Right.
Even now we can look back and be like, a lot of that just kind of went away.
I think because we were in an institution, as a school
Yes.
environment,
Yes.
like it was
You get
taken
stuck.
to like the next level. But we were out of school for about a month and a half. And then our director, he's a military guy, and he was like, we're getting back to work.
Yeah.
And so
Love
we were the
that.
first ones to go back. I did
Really?
too, because our residency is 30 months. And so I wanted as much experience as I could get. And we were back to work, and the other residencies
Yes.
just sat at home, and we were like, no, we're going to do
Yeah.
something.
Mhm.
And my thing was like, to be fair, we were like, if you want to do all that stuff, feel free to. We
Yeah.
weren't like we just personally know the BS, and we're like, understand if you want to do all that, feel free to, but we're not going to change up. Like we're literally in rooms with hundreds of people a week,
Yeah.
touching people, and across the board, our chiropractic friends all did the same things. And there was like no issues with any of that stuff.
I'm jealous.
I don't think we even got it. I'm pretty sure we didn't get it
But the
Wait.
nature of our work is a little bit more intimate,
in
right?
the face
So,
Yeah,
like,
for sure.
the
And
mouth.
and you're dealing with spit and blood and
Yeah.
all
Yeah.
that stuff makes perfect sense for a mask to me.
Yeah.
Do you
You ever had someone
hope
spit
so.
directly in your face?
No, but like when you're using a handpiece, sometimes stuff will
Flares
like
up,
splash.
flare out,
do you wear
Yeah.
a shield, like a big?
We did during COVID,
Yeah.
and sometimes like if the oral hygiene's really poor, then like stuff will splatter
Do
everywhere.
you smell anything? Like, is there weird smells?
Yeah.
You smell it?
Yeah. If someone hasn't brushed their teeth.
No kidding. I always wondered
Yeah.
about that. Sometimes I'm like, should I have a mint before I do this? Because if you eat meat and you don't like floss,
Right.
it smells like
Oh.
dog shit.
No, I appreciate when the patients brush before they come. I mean, we have a brushing station.
Little mouthwash.
Yeah.
So I thought the mask protected you guys. Like I thought you guys weren't smelling anything.
I mean,
You
it
still-
protects from like it's a physical barrier, but like they're
There's still
thin.
some-
Yeah.
Yeah, blood. I mean, it would protect from blood and spit, basically.
Yeah.
But smelling,
No.
you could
can
still smell that.
How about galvanization? Do you learn that term back in the day?
Probably. Can you give me a refresher?
I'm making it up because I'm not really sure, but I think it's when metals interact.
Yeah.
Like different metals create different charges in when they're near each other.
Okay.
Let's just say that's what it is. I'm pretty sure.
Yeah.
And I was a chemistry major, so I should know that. In the mouth, how many different metals are involved, and do you need to know any of that stuff? Because I always got worried, even when they do like amalgam fillings. I had gold, I had braces, I had the silver stuff, I had all kinds of crap when I was a kid, and I just thought, shouldn't we know if this is like creating some sort of issue when they're just talking to each other, positive, negative charges?
Yeah, I don't see any issues with like the charges going on, but there are different metals.
Like working with metals.
Right. And you do have to know like friction and how that affects your mechanics. But most of the metals that we use are stainless steel or TMA, titanium, molybdenum, something
Yeah,
like
yeah,
that, and nickel titanium. So those are kind of the three big ones. And, if you're doing certain kind of procedures like an extraction case where you needed some premolars removed and you're trying to close the space, like there's certain metals that do better with that type of.
Got it. Is there wasn't there testing, or maybe there is testing that you could see if somebody has a sensitivity to any of that stuff?
Mm-hmm.
Because in like the holistic, I did a little dive into the holistic dental world, And there were just a lot of things that were like, oh my God, like nobody really thinks about this, but it does make sense that you're putting something foreign in there. And shouldn't you probably test that to know how well they tolerate it?
Right. So there will be some patients that come and they're like, I have a nickel allergy or
Yeah.
whatever it may be. And a lot of it is due to like cheap jewelry, you know. But sometimes I guess the two kind of tests you can do is you can like tape a bracket on their skin and see if there's a reaction there. But that doesn't give you like a good idea of what could happen in the mouth. So I've bonded one bracket on a tooth and I've given them a instrument and taught them how to take it off if something were to happen, just to be safe.
Nice.
Typically nothing happens. I have not seen an allergic reaction in the mouth.
Yeah, that's good. What do you say to people who say that braces are dangerous and go against nature?
What kinds of people?
I don't know. So this is another thing like I saw in the holistic world that they were saying that you don't really want to necessarily use braces because there's a reason for the teeth doing whatever the heck they're doing. Have you ever heard that before?
I have, and obviously
Like
you're born a certain way,
Yes.
and like a lot of that is genetic, but you know, braces aren't just to create a pretty smile. Like there is a functionality aspect to it, and you can improve the function of the teeth and the mouth with aligning things properly and protect the occlusion. At the end of the day, that is one of our main goals is, you know, if the teeth are not coordinated, then over time you're going to grind and wear on those teeth. And then those are the only teeth you have. So it's like, you know, what's the worst out of the two scenarios? Like, do you want teeth that are worn down completely, or do you want them to be aligned and coordinated and functional?
I like that. So basically what we're saying is the ideal position of teeth is what you're trying to put them in.
Exactly.
And that would be the functional norm.
Mm-hmm.
Okay.
I always heard that, I shouldn't say always, I've heard before that children who are born C-section, because they don't go through the birth canal, they don't have the pressure that starts fusing, is the signal to start fusing their bones together. So they're more likely to have jaw issues at some point.
Y'all are going deep into the functional medicine.
You ever heard of that?
So are y'all talking about like myofunctional like therapy and like kind of their thought process behind like jaw and craniofacial development?
Yeah, maybe how the sutures, when they're really pressed close together. There's the idea behind a natural birth and then the C-section birth. And the natural birth, they're exposed to different bacterias and things like that for their immune system. But then also because it's so much pressure on their head, that's the body's signal that they're born and their head sutures need to start fusing at some point.
Right. But like how long are they in that position? Is that position doing something for such a long time that it's going to affect the growth of the
that's what I don't know. I'd like to see a study where you had a bunch of people come in and say,
too.
"Oh, you were C-section, you weren't."
Add it to your questionnaire.
Decide.
Well, it's like how long. Add it to the questionnaire. My thought would be, how long is the baby actually in that position to have an effect?
Yeah,
and that doesn't seem like it's reasonable. You know, it doesn't seem like it's
it's the signal is the idea. It's you push it. You know how like when you push two things together
like
and then
magnets.
It just starts magnets.
Yeah, like a magnet.
Not even like a magnet. I was thinking like the epoxy. You know, when you have two different types of epoxy and you push them together and then it starts to stick.
Like a volcano.
Yeah, fifth grade volcano.
I guess when I was studying like craniofacial development, we didn't
dive into that
on the signal. That
and I don't know. I mean, there's not really anybody talking about it or bringing it up or researching it.
But you wanted me to talk about it.
Yeah, I did. Yeah. Or maybe someone will listen. I mean, so many people listen to this. Someone might just pick it up and start researching it.
Yep.
Maybe there's a student who wants to come learn on it. Which
Contact me if you got the answer to that.
What if someone wants to come learn from you? How do they do that?
I've had some people come shadow. which, you can reach out to our office and the office manager can kind of coordinate a time.
Mhm.
But I think it's great. I think that's something that I did growing up. I shadowed my orthodontist and some general dentists. I think it's really important if you're interested in ortho to also shadow a general dentist because you have to do that stuff first before you can get to ortho. Like
Yeah.
all orthodontists are dentists, but not all dentists are orthodontists, right?
Yep.
So
Right.
even though I did not want to be a general dentist long term, I still had to learn all of
Do all
that
that.
and do all of it.
How old would you take a 10-year-old that wants to shadow you, or how old do they need to be?
I would think maybe early high school would be
Yeah.
the earliest. When you're starting to decide maybe colleges that you're interested in.
And then were you in school for 12 years?
11 and a half.
Dang. That's a lot
Yeah.
of school.
So many years.
Yeah.
That's why we put your graduation photo up on there. So people
Thanks, I appreciate it.
Now, are you mostly referrals, like dentists refer to you, or can people come straight in? How does that work for the consumer?
I like a referral, but if you're interested in orthodontics, you can always call. The reason I like a referral is because there's less guessing and we can typically get started sooner if there's a referral because either it's a child that needs the interceptive treatment or it's an adult who is a candidate for orthodontics because they've kind of been vetted by the general dentist. If it's random, that's fine. But I'm going to do my research. Have you been to the dentist in the past 6 months? If not, we need you to have a cleaning before we get started. If there's any cavities or restorations that need to be done, we have to get all bacteria out of the mouth before we get started with moving the teeth. There has to be a good foundation to be able to do that.
Nice.
That's good.
Now, do you know that we say we're the orthodontist of the spine?
I didn't know that. Straight
Really?
spine.
Yeah. Yeah. So we should be ortho spinos. So I don't-
Do y'all see a lot of dentists?
Yes.
Yeah.
I should come to y'all.
Well, here's what's interesting. When you mentioned your husband was a fighter pilot, like the amount of force with the helmets and all this, because we have a couple of those too. They're rough. Same with
Really?
dentists, truck drivers, hairstylists. Those are like just
Healthcare in general, we have a
Yeah.
ton of
Interesting.
nurses.
You're bending over people. X-rays. I mean, just very quickly, one X-ray and you're like, oh my god, and
Yeah.
it just pieces everything together.
Yeah.
And we're more like why we say we're more in the orthodontist of the spine. Chiropractic has so many different little techniques and weird. I don't know, not weird, but there is some weird stuff in chiropractic. But we more work on the structural side of chiropractic. So we analyze X-rays, we do all the angles, we do all kinds of things to get it back to that ideal functional norm.
Okay.
Whereas some chiropractic is just like pop your neck, twist your back, hope you feel better.
Yeah.
Come back when it hurts. Ours is very like methodic and detailed and specific to what's going on here. Does that correlate to your symptoms? And then deeper than that, like do those nerves also affect your stomach, your intestines, your reproductive organs? I mean, so we're linking all that from a functional standpoint. So we literally we always say like we're orthodontists of the spine all the time.
I love that. I need
Yeah.
to come see y'all. I've
Yeah.
had one experience with a chiropractor and it was fine.
Yeah.
I guess in college, a guy popped my back, like, when
Yeah,
they
yeah.
like bear hug you
Yep.
and like lifted me up and it felt good for a second. And then he put me back down and I had trouble breathing.
Yeah.
And it's like my rib from the back was poking my
Yes.
lung.
Mhm.
Yep.
Well, and what's interesting about our profession is so many people have never had an X-ray of their spine, so they have no clue what it
Yeah.
even looks like. Whereas in the dental world, most people that I talk to have had an X-ray of their teeth.
Or smiled in the mirror.
Yeah, or
like
they
they could at
see
least
it.
see it,
Yeah.
Lots of people come into us and they have no clue, and they'll look at it and they'll have osteoarthritis and osteophytes and disc degeneration, all kinds of issues. And they're like, "Oh, I'm 50 years old and I've never even seen it before," but they've had 20 dental X-rays in the past
Right,
20
yeah.
years, so they have a pretty good idea about that.
Yeah.
I had a question about
Oh yes. Randy's
Like-
Randy's excited to answer this.
I don't know what it
you-
is yet. It depends what it is.
You're on the spot now. When you pop the neck, I feel like I've heard people getting tears like in arteries if things aren't done properly, or what's something you could say to someone that might
Yeah.
be fearful
Oh yeah.
Yeah.
of coming to see y'all because of that.
Well, so there's been studies done on it. They did hundreds of thousands of people on it, and they didn't find a single one. So there was people that said that. So they were like, "We're going to study it." They did hundreds of thousands, not a single one.
They didn't find a correlation.
No correlation at
Okay.
all. They didn't even find anyone in the study. They're like, "We've done hundreds of thousands of people. We don't have enough money to keep doing more."
Okay.
So that would be one. Number two, we always take X-rays. So I know there's some people who just go somewhere, no X-rays, just get adjusted. We never do that. And there's been many times when I'll take an X-ray and I'll see, oh, they've had fusions, or they've had something broken, or they've had a compression fracture. They've had some
a congenital
anomaly, like some big contraindication. So then
Okay.
obviously we would never adjust them. And then we have multiple different techniques that we do. So I think back in the old days, they would just adjust everybody kind of the same way, aggressively.
Yeah.
Now we've got all these different tools and techniques and tables and different things. So, I mean, even the way that they used to adjust, we barely adjust like that anymore, or minimally.
Yeah.
So an X-ray is not going to show you like the arteries
No.
and like the nerves. So how would you know if there was like a tear or, something like that? I mean, obviously
Yeah.
they're going to have symptoms.
That's exactly it. The risk, like what you're describing, the risk comes in not being aware of what the person's presenting. So
Okay.
if the person was presenting to have a stroke or a tear, or whatever it may be, you would know that before you would even
Right.
get to X-rays, and then that would be a concern where you would have them do follow-up. So if somebody's not thorough in that, that's where it can become a big problem. But it's like, well, they were going to have it anyway,
Right.
kind of thing. If that
Okay.
makes sense.
Yeah.
And then the other big thing, I just lost my train of thought.
Malpractice.
Oh,
insurance.
malpractice.
Yeah.
Yes. In malpractice was always like, that was when we first started hearing little things like that. I was like, all right, so if this is happening and people are so scared about it in the community, there'd be people all over the news being like, hey, just drop dead from my chiropractic, adjustment. And then the malpractice insurance for chiropractors would skyrocket because there'd be
Right.
so much risk.
Yeah.
So then that was another, it was like, compare what we pay for malpractice a year is $700
Yeah.
maybe for the whole year.
That's less than what I pay.
Yes. So that's
Like
exactly it.
crazy.
So it's like there's a higher risk of walking to get your teeth straightened than to come in. And
This
we're
could be
talking,
great for business.
yeah, we're talking thousands and thousands of adjustments.
Yeah.
Like Randy's done over 200,000 adjustments.
Probably close to 300,000 now.
Wow.
Yeah.
With zero, but that's where these stories are just so wild.
And
Yeah.
but there are chiropractors that aren't great, like for
Yes,
sure. So if I hear a
yes.
story, I'm like, like that guy could. I hear weird stuff that chiropractors did all
But
the
you
time.
have
So I
to be
think you have
board
to vet.
certified.
I think you have to vet your chiropractor for
Yes.
sure. But then and it would probably be the similar to if you heard someone had a really bad reaction to anesthesia and something happened, or a dentist they were drinking and went in and they were drunk and doing something and caused an injury. It'd be like, well, that looks bad for dentistry, but
Yeah.
also that person should not be drinking and doing and practice. You know what I mean? So
Right.
I think there are valid concerns where there are chiropractors who just aren't careful or aren't focused or don't care, or something's wrong with them. But we've never had, we do tens of thousands a year
No
and
issues.
never had a single issue.
That's good to know.
Yes.
And then how often do your patients come back to see you?
It all depends on the person.
Okay.
Yeah. I check my kids once or twice a month, see how their spine's doing. I've got one that's really wild and just falls off things a lot. So
Yeah.
she gets checked more often. My wife, she was on the verge of back surgery when she was 17. And so she has like the genetic issues, I think. And then she had all the issues that came with horseback riding injuries and basketball injuries. So she still gets adjusted more often than I do, who I've been adjusted since I was 1 year old, my entire life.
He grew up in
I grew
I was
up
about to
in
say,
it.
were
I
your
didn't-
parents
yeah, I didn't.
chiropractors?
No,
mine.
I just had terrible ear infections, and my parents were doing the antibiotics, and someone convinced them, you got to try this chiropractor, and they're like, this is so weird. I don't think so, but they were like, I guess if we're going to do ear surgery, we might as well just give it a shot.
Yeah.
And it got better, and then they were like, all right, we're into this. And then my parents started getting adjusted. My 2 younger brothers started getting adjusted right at birth, and then we've all been adjusted our whole life.
Are there any contraindications to doing massage therapy and chiropractic
Nope.
work?
No.
We have we
that
actually have
something?
we have massage therapists here. Yep.
Nice.
Yeah.
We do them both. They're different. Like, and
You
some
need muscle work with adjustments.
Yes.
That's the big thing. That if you don't do muscle work, because they're all connected,
Right.
So but people that just do muscle work, they go just get a massage, or they go just do dry needling, or they go and do like anything muscle wise. Those are still attached to bones. That if those bones
Right.
are off, you're just only getting one piece of the puzzle.
Because I do massages like once a month.
Yeah.
I have to.
Yeah.
But
100%.
I've been curious about
just-
the
yeah.
relationship.
Mhm.
And then once you start working on the spine, you'll see the pattern of your massage, like everything changes because you just keep getting the same thing, and it's the same area that the massage therapist is probably like, "Yep, you're tight here again."
Yeah.
It's like, well, there's a reason.
They're like, are you doing your stretches?
Yeah.
Right. Well, and I think of it even like for the dental comparison, because we do a lot of dental comparisons where everybody should take care of their teeth from birth to death, where they should brush their teeth every day, where they should go to a dentist regularly, all the things. I'm like, we look at your spine the same way. It needs to be lined up a certain way. It needs to work a certain way. You need to do stretches every day. You need to do home exercises every day. You need to get an x-ray once a year. You need to, if you have one issue, you need different things. So sometimes they're like, oh, well, what about a physical therapist, or what about yoga, or what about stretching, or what about getting adjusted, or massage? And we're like, we do all that stuff. It's different. That's like saying I have a periodontist and an endodontist and an orthodontist and a general dentist. It's like you can't really get rid of any of them. You need all of them at certain times for certain things.
Yep.
That's funny. I do my comparisons to like a contractor sometimes because people get upset about having to continue to pay for treatment if you get done early.
Mm-hmm.
So I'm like, okay, well, if your contractor, is doing a kitchen renovation or something, are you going to be upset with your contractor if they get done early and not pay them?
Yeah.
It's like, if people don't really understand it until you relate it to something as convenient as that. So
yeah, some people would probably pay extra to be done early.
Right?
You would think.
Yeah.
Maybe they should pay me extra.
Right. You should say if we finish extra, it's going to be more.
Nice.
All right. Anything else? How do people find you if they want to get a hold of you? They want to come see you?
Midlands Orthodontics off of 2 Notch Road.
Perfect.
How do you like Columbia too? You've been here for how long?
Since 2022.
2022?
Yeah.
Nice.
Beginning.
How you like
brand new to it?
Yeah. It's great. Honestly, as far as military assignments go, it's awesome.
Yeah.
I mean, my husband's over at Shaw in Sumter, so he commutes. But Columbia is awesome. It's kind of strange, but it has, the college kind of feel, and but it also has up and coming restaurants and outdoor activities, and it's easy to get to wherever you want to go. If you want to go to the beach one weekend down in Charleston,
right?
Love that. Charlotte for some shopping, and even Columbia has pretty good shopping too. So
could your husband, this is a side note real quick, can he, like, if he wanted to charter a flight, like if he just was like, hey, I'm going to rent a plane, like just one of those little puddle hoppers to go to, like, I don't know, Myrtle Beach.
Yeah.
Can he just go to the airport and do that and just fly it? Or does he need a different license for that?
I think he could, but if he were to fly other people, he could do it alone, I think.
Gotcha.
But I think
like if he wanted to take you to Florida and it's like,
he would have to get some sort of like license, even though he has like the flight hours. I think that would like translate in a certain way.
That'd be awesome. I never thought about that.
I would love to get a plane
That's
one
what
day.
I'm saying. Why don't we? Let's talk.
Yeah, let's
What's
go
his
to the
name?
Keys. Let's hang out with him.
Getting married to a fighter pilot the same year that Top Gun 2 came out, it's like we talk about, like, if someone asks us what our careers are, they hear mine and they're like, cool. What about you?
Yes. Yeah.
Back to the pilot, which, it is impressive what they do every day. It's awesome.
Who was your favorite character on there? The shirtless blonde guy?
On Top Gun 2?
Yeah. Maverick.
Miles Teller.
Yeah. Is Miles the one with the mustache?
Yeah.
A lot of people liked him, but then my wife liked, and I don't know his name, the blonde haired dude that was Gosh.
It's like I know in the first one it's Iceman. It's like kind of the villain.
Yes. He's kind of his like protege type of person. I wish I knew his name. We now have I'm bringing it up because we have a poster of him in our bedroom. And
Is your wife into that?
she's into it.
All right. Well, we appreciate you being on this show. Thank you
Thank
so
you for
much.
having
Everybody go
me.
check her out. Midlands Orthodontics.
Here
We're here for the health of it.
for the health of it.